office. This is an important conversation as we start to come out of the shelter in place. My name's Beth Unverzad, and I direct the statewide after school network, and we're part of a national initiative of all 50 states working on after school and summer programs. So I want to introduce Alyssa Chatterjee from the governor's office. She's the Deputy Director of Education, and then our facilitator, Bethany Tramer, who works for Oregon Ask. Then this is being recorded and we will share it with others, so know that. And we are collecting the additional questions that are in the box, and we've tried to organize all the questions that have come in, and we'll be going through those after Alyssa does her presentation. So I'm going to turn it over to you, Alyssa, so we can get your PowerPoint up.
Perfect, thank you. I will start pulling that up now. Perfect, thank you, Bethany. As Beth mentioned, my name is Alyssa Chatterjee. I'm the Governor's Deputy Education Policy Advisor, and wanted to come back today with a new version of summer camp guidance that the Oregon Health Authority has developed. I believe I'm being joined by some of my colleagues in the Oregon Health Authority. I think we should have Kati Mosley on the phone, and we may have some other senior health advisors joining us as well. Kati, are you on?
I am, thank you.
Great, thank you. So I'm going to quickly run through this slide deck, and again want to leave most of the time for discussion and questions. You'll see a couple of repeat slides if you tuned in on Monday, but hopefully some new information. So once again, just want to remind us of the reality that we'll be living with this virus until there's immunity, and that's many months off. Wanted to remind folks again of this graphic, which really just reminds us that our goal is to keep the curve flattened. So this blue line indicates cases with continued aggressive interventions in line with the stay home, save lives order. And that orange line is a return to moderate interventions. And so what the governor talked about today in her reopening discussion, and what we'll see in the guidance that I move through, is really trying to ensure that we don't reduce physical distancing too quickly and create a spike in cases. So some of you may have heard the governor's press briefing this morning, but wanted to provide you kind of an update on the current state of reopening. So on May 1st, non-emergency procedures, medical and dental clinics were able to start at 50% capacity dependent upon PPE. On May 5th, our office announced that recreation or physical distancing can be followed was opened. And today we were able to share that beginning May 15th, standalone retail that was previously closed may reopen, and childcare, summer school, camps, and youth programs will be allowed to reopen starting May 15th. And reopen, I think, can have a misleading term, particularly when we think about childcare, since childcare has been able to operate under this emergency childcare framework, and that framework will continue. For both childcare, summer school, summer camps, there will be really specific limitations, and the guidance is what I'm going to walk you all through today. So just a quick summary of the phases. I know we've talked a little bit about counties reopening in phases. There are some statewide applications. And so summer programs, education programs, childcare, that is included in this statewide reopening. So while we are talking about phases for some counties for things like restaurants and bars, salons, gyms, in-person local gathering increases, summer camp programs across the state will be able to reopen beginning May 15th, and we will be walking through the guidance required for those programs to adhere to. This is a quick summary of the public health guidelines that have gone out for individuals. So again, trying to practice good hygiene, wide use of face coverings in public, staying home if sick. For employers, trying to monitor workforce for indicative symptoms, contact tracing. This will all be folded into the guidance I'm walking through for summer camps. So as a reminder, we're focusing on outdoor, indoor, and overnight camps. I will indicate, you'll see in a couple of slides later, if we're only talking about a certain subset of those camps. So first, I just want to remind folks that this is a draft, and we're again trying to balance returning to summer camps under modified conditions and trying to maintain health and safety of both campers and camp staff during COVID-19. So camps include any formal grouping of children for a defined period with teen or adult counselors. This includes sports camps, music camps, nature camps, and art camps outside of licensed childcare centers or formal summer education activities through a school. So this is, again, preliminary guidance. Day camp programs that are not associated with a licensed organizational camp facility are sort of an exception, and we're still working through what the enforcement and oversight for those non-regulated camps will be. So jumping in real quick on the first piece of this guidance, and again, this is indoor, outdoor, and overnight summer camp. So communicable disease management plans. All programs should have a written communicable disease management plan. This should include protocols to notify the local public health authority of any confirmed COVID-19 cases among campers or staff, process and record keeping to assist local public health as needed in contact tracing, protocols for screening campers and staff for symptoms, and a protocol to restrict from camp any ill or exposed persons and possible cessation of camp activities. So that's sort of the broad framework of what a communicable disease management plan should entail. In addition, and some of this will help your plan, we are including the requirement to keep daily logs for each stable group of campers that conforms to the following requirements, again, to support contact tracing of cases if necessary. In addition to that log, we're also recommending through the health authority that there's restrictions from camp of any camper or staff known to have been exposed to COVID-19 within the preceding 14 days, communicating advice to staff not to work, and guidance to parents not to bring their students to school or camp if they or anyone in their household have recently had an illness with fever or cough. They should remain home for at least 10 days after illness onset and until 72 hours after the fever is gone without the use of fever-reducing medicine. If anyone who has entered, and this really actually should say, I know this was in the draft guidance, but this is the summer camp facility, is diagnosed with COVID-19, they should report to and consult with the local public health authority regarding cleaning and possible program closure. They also must report to the local public health authority any cluster of illness amongst the program staff or students. For general operation, camps must frequently remind all staff and parents to keep themselves and their children home with any illness involving fever, cough, or shortness of breath. Advise staff not to work and not bring their children to camp if they or anyone in their household recently had an illness with fever or cough. Again, remaining home for at least 10 days after onset and until 72 hours after the fever is gone. Provide hand washing facilities, tissue and garbage receptacles that are easily accessible to both children and staff. And all persons in the camp should be advised and encouraged to wash their hands frequently. Except when eating, preparing, or serving food, and after using the restroom, alcohol-based hand sanitizing products may be used as an alternative to hand washing. Staff and campers should be reminded frequently of the importance of respiratory etiquette, so covering your cough and sneezes, throwing away tissues, and cleaning hands. Face coverings are recommended for children over 2 years old, and staff should be used according to CDC's guidelines. So these face coverings should never be worn while sleeping at overnight camps. To minimize contact during drop-off and pickup, allow parents to remain outside of the building for sign-in and sign-out of their children, consider staggering drop-off and pickup times, and prevent contamination from touch points such as riding implements, so signing your child in and out. In terms of screening, there is guidance to evaluate temperature and check for coughs of anyone entering the building. Individuals with a fever over 100.4 degrees Fahrenheit should not be allowed to enter. Temperature checks conducted by facility staff are preferred to assure accurate assessment of fever symptoms. If it is impossible for the facility to check temperatures, programs should ask families to affirm that their child does not have a fever. If the camper or staff member develops a fever, cough, shortness of breath, or other symptoms, they should be isolated away from others immediately and sent home as soon as possible. Again, they should remain home for 10 days after illness onset and until 72 hours after the fever is gone. We also need to ensure that the camp has flexible paid sick leave and absentee policies that discourage staff from reporting to work while sick. If anyone who has entered the camp facility is diagnosed with COVID-19, it again needs to be reported to and in consultation with the local public health authority regarding cleaning and potential need for closure. If anyone who has entered the camp facility is diagnosed, oh, sorry, I think this is a duplicate, but again, you're reporting to the local public health authority. And if there's any cluster of illnesses, it's important to notify the local public health authority. Physical distancing. So daily activities and curriculum should support physical distancing, striving to maintain at least 6 feet between individuals. For example, you could adjust the programs by eliminating large group activities, so larger than the stable cohort, increasing the distance between children during table work, planning activities that do not require close physical contact, and others. For cleaning and disinfection, clean, sanitize, and disinfect frequently touched surfaces, such as door handles, playground equipment, drinking fountains, multiple times per day. Avoid the use of items that are not easily cleaned, such as softer plush toys. Ensure safe and correct application of disinfectants, and keep these products away from children following labeling direction as specified by the manufacturer. Ensure that ventilation systems operate properly, and increase circulation of outdoor air as much as possible by opening windows and doors using fans and other methods. Again, do not open windows and doors if doing so poses a safety or health risk, for example, exacerbating asthma symptoms to children using the facility. For field trips and transportation, the guidance right now that's being proposed by the Oregon Health Authority recommends that neither campers nor staff should travel with others outside their stable group. Vehicles should be cleaned between each group of students and staff following transportation guidelines. Food service, all usual food handling protocols should be observed, and campers and staff should wash their hands with soap and water prior to eating. Campers should bring their own food if at all feasible. Campers should be instructed not to share food with other campers, and if food is served by the camp, individual plating of meals is preferred. Family-style food service should not be allowed. These are some sort of miscellaneous pieces of guidance. So camps held in state parks should follow the general camp guidelines as above. Any other guidelines related to the location of the camp. For example, camps in state parks should follow state park guidelines as well as summer camp guidelines. Staff may be trained prior to formal start of camp if physical distancing can be maintained. For high-risk employees and campers, the nature of congregate gatherings raises the risk for individuals with health conditions and/or age that place them at higher risks of adverse outcomes with COVID-19. So those in higher risk categories should not attend camp settings where adherence to physical distancing is not likely to occur. And you can see here the quick list of who's defined as high risk. So those 60 years and older, chronic lung disease, immunocompromised, and other underlying health conditions. This piece of guidance is specific just to indoor or outdoor day camps. Camps must be limited to maximum stable groups of campers, and stable means the same campers in the group each day. The stable group may change no more frequently than once per week, and half-day camps hosting different morning and afternoon groups may be offered, but sanitation measures must be taken between those sessions. For overnight camps, camps again must be limited to maximum stable groups of campers, and they may change no more frequently than once per week. There should be maintained at least 30 inches between beds, and children should sleep head to toe. So the top bunk would have the person's head at one end and the bottom bunk, the person's head at the other end. And adjacent top bunks and bottom bunks are similarly arranged so that the head of a person in one bed is at the other end and the head of the person in the next bed. There should be an enforcement of a prohibition against sharing personal supplies, so hairbrushes, pillows, caps, contact lens solutions, etc., and a recommendation to increase the distance between campers and staff in dining rooms. This could look like having people fill their plates inside, or consider staggering meal times. So that's a very quick run through of the draft guidance, and then I want to pause for questions and feedback. I'm happy to flash this slide up again later. I know Beth and Bethany are going to be capturing all the feedback and questions today, and folks are also welcome to send feedback to me via email by tomorrow at noon, and we will incorporate it in this last round of guidance.
Thank you so much, Alyssa. I know we've had many questions come in over on our chat box, all of which we want to be able to get to, but I think that there are a couple kind of easy ones that I want to make sure we address. There were questions around timing, and so the phasing that we don't now know what that phase is going to be, and I think that's true. But there was a question here from Rachel, I believe, I'm sorry, not Rachel. Yes, Rachel from Boys and Girls Club. Did you want to ask your question around the youth programming and children programming and phasing?
Sure.
You want to?
We had previously been talking about different phases of reopening, phase 1, phase 2, phase 3, different group sizes, etc. But it sounds like from this, across the board, regardless of county and regardless of phase, childcare, summer camps, and youth programs are allowed to reopen on May 15th.
That's correct, adhering to the new guidance that goes out next week, which will be some modification of today's, yeah.
Okay, thank you. And then I didn't see mention in your slides, but does that include, what is the size of the stable groups? Because we'd previously talked about phase 1 was 10, phase 2 was et cetera, et cetera.
Right, yeah, no, that's a great question. So because you kind of removed this phasing approach, the stable group size it would remain at 10. And I think something that's been easy to blur is the phases apply to kind of counties reopening and the businesses that are impacted. It doesn't necessarily apply to how programs change their operation. So that's one of the reasons why this would be 10 across the board, regardless of what phase a county is in.
And then to follow that up, several questions on the max group size. So if you have stable groups, but using the same facility space, is there a different number that particularly camps and places where there's going to be, where previously there was hundreds of kids, is there a max, and is that associated with a particular square footage or space or anything like that?
Yeah, and Kati, feel free to jump in. It's my understanding that the maximum group size is 10. One of the things we're trying to do with summer camp guidance is make sure it's consistent with childcare and summer school guidance. So Kati, correct me if I'm wrong, and we can talk about this more. In childcare, in a certified center, for instance, if there's a physical barrier between groups, so if you had an auditorium, for example, cones or chairs could be used to delineate the group sizes of 10. And is it your understanding, Kati, that would still apply in summer camp as well?
It is. I mean, as you said, there's still discussion and figuring out of this, like how to articulate it clearly, but these will be in alignment. And I don't have the square footage reference in my head, but I think the childcare guidance, as you said, they have a certain square footage and number of people. And then within that, the stable groups have to be accommodated at distance from each other.
Yeah, and I don't know, Sarah Michelson, are you on with us from the Early Learning Division?
I am. I was just going to put in the chat that it is 35 square feet per child. That is our requirement.
Thank you.
So someone had asked, does that include outdoor camps of all sorts?
So yeah, so these, again, Kati, correct me if I'm wrong, this guidance all applies to indoor, outdoor, and overnight camps. So whether your program is indoor or outdoor, you would have to adhere to the stable max groups of 10. And I think we're also open to feedback on clarity, particularly for outdoor camps, since square footage is sort of a weird way to handle groups outside.
And so maybe if there is someone that would like to jump in on this, I know that there are a lot of summer camp places and places that normally rent out their facilities or use them for much larger groups than 10. Does anyone want to join in and share feedback on if, particularly in this overnight setting, there was comments and questions about this that came in previously around having a stable group because you've got the kids in one location for a week or more, and being able to bump up that from 10. Does anyone want to raise their hand or unmute yourself and share? Yes, Todd, I see a hand raised.
Well, I think the Boy Scouts are pretty unique because our groups come with their supervision with them, right? So a group of Scouts come with their adult leaders and they experience the program together in a group. And so the National BSA has suggested that maybe, of course, they're talking about giving us some ideas for that to the whole country, let alone just us, but that we do treat them in groups of 10, but in concentric circles of groups of 50 at a time. And so that's 2 adult leaders and 10 youth is a group, and then there'd be 4 groups in a concentric circle that would stay together for the whole time. So that group would go to the waterfront, would go to the nature area. If we decide to open up our rifle range, maybe to the rifle range, go down to the beach, right? They would eat together and they would stay together the whole time. But that would be very rarely do people come with only 10. And of course, our participants include adults, which is kind of unique. And that's kind of what the big guidance that we're kind of looking forward to is, well, what would that look like? You know, when you consider that, because most of the people we talk to within the ACA, you know, the kids come and get dropped off where we have our own mentors that come with us, right? So that could be a challenge for us.
That's helpful. I don't know, Kati, if you have any kind of clarifying questions with that. I think that is something we can add clarity to. Kind of what I'm hearing is sort of this question of what's that sort of maximum. Is there a limit on the maximum number of groups of 10 that we can have in a space, I think is one part of the question. And then is there an ability, particularly for some of our overnight camps, to be able to have a kind of a cohort of multiple stable groups that could kind of go together? And we can talk more about that. I don't know, Kati, if you have any other clarifying questions.
Yeah, no, that's helpful. I think it sounds like in that scenario that the adult mentors would be camp staff. So I think our draft guidance does start to address both staff in that ratio and then also support for children who might need additional one-on-one personal support for whatever reason. I think too that to make sure that there's sort of a common sense application of if you have 5 stable groups in a large indoor-outdoor facility, 5 stable groups of 10, they can't all go to the auditorium at once if there isn't adequate square footage to accommodate social distancing for all of those individuals in that space, but a stable group could go there, and then sanitation would need to be maintained between those groups using that space. Tom, do you have anything to add?
Oh, sorry, I clicked the wrong button.
It looks like you're still muted, Tom.
Yeah, I think you clicked it again.
I'm sorry, I was asking Tom Jean from OHA if he had anything to add. I realize now there's probably more than one Tom on this call.
So I think there's a clarity question. So 10 kids with 2 adults is one group, correct?
Yes.
With a 35 square foot stable group.
Yes.
Yes.
35 square feet per child.
Okay.
And then when
Which is a normal school building.
Right.
That is a normal school building.
Mm-hmm.
There's another question here about the use of schools. And
Mhm.
schools, it's my understanding that schools will not actually be closed until June 30th. School day isn't closed. So do we have any idea when schools will open for the youth by programs? Or is that a district by district decision?
I don't know if we have Colt or anyone from the Department of Education on with us that wants to jump in there.
Yeah, this is Cole. I think that it would be a district by district decision. So schools are closed through the remainder of their school year. June 30th is in that executive order because some of our districts are year rounds. And so we had an end date on that order. But you know, if a district had planned in their calendar previously to be done on June 12th, then that's their final day.
Okay.
So all the programs that typically work with school districts can connect with them. I think that it will be more complex for the districts, frankly, because they'll also be thinking about summer school opportunities to make up for lost learning time. Once we get that guidance out aligned with this guidance, so they may be needing more space. And then some districts are also considering early start to the next school year or earlier than usual starts. And so if they have bond measure construction going on or anything like that, they're going to want to have, you know, access to their buildings. So it may be a more challenging summer. I don't know that that's true in every district, but just know that that's probably some of what's on their plate.
Okay. And will they tell you, when will they tell you this about school opening early?
I think that I think over this next month and a half is when they'll get guidance on what the fall opening of school looks like. And so until they have that, I don't know that they'll be ready to tell.
Okay, so they don't have, their budgets are in June 30th, so we probably won't know.
Right, their budgets are due June 30th, and they don't have all the information they need until the May 20th revenue forecast. So they're right now waiting for information from the state about how much money they'll receive.
Okay, great. Thank you, Colt.
Mm-hmm.
So we have a number of clarifying questions. Is it 10 students and 1 adult or 2 adults, or how many adults would be able to be with them? Does that include floater staff? And I'm gonna keep going. Would it be possible for those stable groups to move into different spaces throughout the day, assuming that they adhered to cleaning procedures throughout?
So I will start, and then Kati or Tom Jean, feel free to jump in. So it is my understanding that we are not putting a limit on the number of adults that can be with the stable groups. But this whole definition of stable, right, is that you wouldn't see a turnover of adults with each of these groups of children. We recognize the need for floater staff, and they would be asked to adhere to strict, cleaning protocols. If we're looking at developing similar requirements in childcare as well, since these staff will be mingling with multiple groups, and that's an easy way to spread the virus among stable cohorts. But I do not believe, and Kati, correct me if I'm wrong, that we are recommending that there's a limit on the number of adults interacting with each stable group.
And then another big question over here is there a max number of stable groups in a space if all of the other spacing and cleaning and requirements are met?
At this time, there is not. So as long as we will continue to work on sort of 2 pieces. So we're recommending max groups of 10. And again, Kati, correct me if I'm wrong. We're not saying that those max groups of 10 are necessarily dependent on 35 square feet. I saw a question come in through the chat box about cabins. For cabins and sleeping, that's where the 30 inches of head to toe kind of comes into play. But as of right now, this guidance does not recommend a maximum number of stable groups. So if open to thoughts and feedback there, but we're not putting a maximum there. Again, if all the other cleaning protocols, staggering, you're maintaining these stable groups of 10, then you can have as many stable groups as possible while maintaining all these other pieces.
Oh, thank you. And then is there, I'm sorry, is there a likelihood that any of these numbers might change? So a lot of questions on if this is going to be throughout the summer, or if there might be, particularly as reopening happens, any changes or updates to numbers throughout the summer.
Again, Kati, jump in. It is my understanding, at least with summer camps in mind, partly just because of how quickly you guys will have to operate in the short time frame you're operating in, that the number, this 10 stable group number, would not be changing throughout the course of the summer, regardless of the phase their county is in. Kati, is that your understanding as well?
That is my understanding. I mean, I think everything's going to change over the summer, right? Everything's been changing for the last like 2 months, but I would trust you, Alyssa, to have the most up-to-date information on those determinations at this time.
And so a clarifying question, within the stable group, are they expected to stay 6 feet apart, or can groups be that distant and that be considered sufficient?
Yeah, so a couple things. One, this guidance is targeting, for the most part, school-age children. And so we recognize that some of the earlier grades might, or 5, 6, 7-year-olds might have more difficulty maintaining physical distancing within their group, but that's sort of the goal. Kati, can you speak to the physical distancing between groups, and if there are any thoughts there? Or I don't know if that's a Tom question.
I would ask him to weigh in. I think the ideal is a minimum of 6 feet, and we're seeking to layer on additional protections by having stable groups and sanitation in between groups and things like that, because these are young people, and it's not, they need layers of protection rather than relying on one thing. So I believe that 6 feet is the gold standard, knowing that kids are social creatures and will require multiple ways to be protected. Tom, Jean, do you want to add anything to that? He may not be able to unmute. I know he called in.
So there's a question here from Catherine Law. Kathy, do you want to ask this question about late August?
Sure. So can everybody hear me? Yeah, so programs like mine do camps week at a time. We're not setting up a summer program that is the same thing all summer long. So we have distinct camps that might be for one group of kids in late August or mid-August. So it seems like if schools are opening, then we might be able to go higher than 10 kids in late August. So I'm wondering if you can update the policies at some point.
Yeah, I think to Kati's point, we will continue to evolve. I think this phasing and statewide conversation is a great example of how quickly things can change. So I would not say it's off the table completely that we would reevaluate these numbers and make changes over time. I think at this time we're not planning to. That does not mean we won't, and we'll continue to kind of monitor what's happening across the state, what's happening in summer camps, and continue to work with the health authority and experts like you to make sure that we're keeping kids safe. And if we're able to serve more children, we'll do our best to make that happen.
So how will we find out if that changes? So for right now, I have my camps capped at 10 kids. If I can find a space big enough for 350 square feet. Mm-hmm. So let's say I cap it at 10 kids and start a wait list. When will I know to let those families know? Are somebody going to send out a mass email, or how will I find that out when parents are saying, what about my kid on the wait list?
Yeah, that's a great question. That's honestly one of the reasons I don't know that we would make changes, but it would likely be in a way we'll be releasing guidance right now. So the governor's office and the Oregon Health Authority would release guidance to the public, and we again would work with Beth and Oregon Ask to make sure that as many folks as possible have notified of any additional changes after the guidance is released on May 15th.
Yeah, and we'll commit to keeping everyone updated.
I think I just heard you say that that's why you maybe want to keep the policy consistent. I can tell you that parents and people who operate my kind of programs would actually prefer the opposite. They're going to say, they're going to be hoping that you change the policy. They're not going to want something that's now in May and that doesn't make sense to them in August. They're going to be asking, why can't, if schools are opening in August with 25 kids in a classroom, why can't your camp?
Absolutely.
So,
well, and I would say, Kathy, we don't know that schools will open with 25 kids in the classroom. I'm just saying,
if it does, then we're going to start getting all those questions. So why I appreciate you not wanting to change policies. I think it's actually going to create higher levels of anxiety and more problems if things are shifting and we can have more kids, but we said we made a decision in early May, so no, we're not changing, we're not being flexible.
Absolutely, that's very helpful. And we're continuing, and Colt, feel free to jump in, we're continuing the governor's office to work with Department of Education, Early Learning Division, the Health Authority, and others throughout this process. So we're staying aligned as much as possible.
Okay, thank you.
Yeah, I agree, and I would only just reiterate what both Katya and Alyssa are saying, that it changes daily. So we'll continue to watch, and it doesn't mean that one piece of guidance is going to be perfectly aligned with the next one, because as we iterate over time, you know, the opening of schools could look a little different than summer school and summer programs.
Thanks. I wanted to note a couple of questions that keep coming up. So we have a number of people asking about swimming. So I know this come up before. We touched on field trips, but use of swimming pools or freshwater lakes has come up, and if there will be reference in guidance on those.
Yeah, Bethany, is there a way that Tom can unmute his phone? Is there like a star something? Because I'd love to get, yeah.
I believe there is, and I can also
Hi everybody, this is Tom.
Oh, great.
Can you hear me?
Yes.
I finally figured out there's multiple mute buttons I had to deal with, and so I apologize for not chiming in earlier. So yeah, this is Tom Jean. I'm one of the senior health advisors at OHA working on the COVID-19 response. With regard to swimming, that's something we've just started talking about. Obviously, swimming in a swimming pool, you've got chlorine or other disinfectants in the pool, and that is a reassuring thing. In terms of swimming in lakes, I don't see a big difference off the bat in terms of risk, as long as physical distance is maintained. But I think that's something we might want to check the literature on, and I'm not sure there's anything specific to COVID-19 and swimming out there at this point, but that's something we're going to be looking at. So I'm sorry I don't have a more specific answer at this time.
Thank you, Tom.
And I see someone has raised their hand, Robert Sahlberg. Did you want to unmute and ask a question?
Yeah, I'm just wondering, you've referenced, can you hear me?
Yep.
Yes.
Okay. You've referenced a couple times summer school guidelines versus summer camp guidelines. And so the program that I run is a pretty specific, more like a school-based program that has kids in 3 classes, and then they're in a production. It's a theater camp or theater program. So I'm just wondering, is there a way to get a view on the summer school guidelines and how they differ from the summer camp guidelines, and how we determine whether we'd be a summer school or a summer camp? So yeah, because we have classes of about 12 to 15 kids, but everybody's in 3 classes, so it would be impossible for us to run ours with cohorts of 10 and that's it, that never intermingle, because we've got different teachers teaching multiple things. So I'm trying to get clarity on camp versus school and how those guidelines are different.
Yeah, go for it, Colt.
So I think the guidelines are going to look very similar in those aspects. So anything that has to do with the public health side of of what they look like are going to be very similar. So the cohort sizes, the cleaning issues, all of that will look very much the same. I think probably depending on our guidance is going to go to public and private schools, and it is about academic courses along with some enrichment. So I think that might be more the difference, not so much the public health parts, but the content part.
Thank you. I wanted to note, I've got a couple other hands raised, but the question that's come up several dozen times now, on the use of balls or other shared equipment. So a lot of sports camps that, you know, having to limit the size, but then how about using shared materials?
Yeah, I'll turn to Tom or Kati for that one.
This is Tom. So sorry, the question is about shared materials in what setting, or what is the specific question?
Around like sports camps, so sharing balls that you would be touching among the group.
Oh, right. Yeah, so I don't know if I haven't, I wasn't directly involved in the drafting the guidance up to this point. Obviously, if you're playing a sports game and there's a ball that it comes into contact with different people, that would not be possible without touching it. And so I don't know if that's something that would just be recommended to against playing those games versus you know, frequent hand sanitizing during the games. So I think we have to think about the logistics and whether that's something that we could recommend at all. Kati, do you have anything to add?
I think that's I was going to say is probably whether it's sanitation or if the equipment should stay with that stable cohort. And I've made note of that we need to have more conversation at OHA about that. That's helpful to know that that's a specific question. I think the question of game playing is one that has to stay within the stable cohort, because otherwise I would imagine that would be two stable cohorts interacting with each other in close proximity and sharing equipment, and that might complicate being able to live up to the guidelines. Tom, do you have a comment on that?
Yeah, certainly to the extent that it's possible to maintain that stable cohort and minimize the contact between cohorts, that's what we'd like to encourage.
So there's follow-up questions around other supplies, art supplies or playground equipment that would likely be between stable groups, and could you clean it in order to be able to use it?
Yeah, this is Tom. So I mean, playgrounds, for example, I think it would need to be cleaned between use from different cohorts in keeping with the rest of the guidance.
Yeah, and that's mentioned in the guidance, I believe.
And just, I want to note, Michael made a comment over here in that if sports camps aren't allowed to use shared materials at all, it's really not possible to do that kind of camp. I don't know, did you want to share a little bit more about if there's thoughts on what might be allowable adhering to the stable groups, or how you would suggest being able to do that with your group, Michael?
Yes, thank you. So really my suggestion would be to have either new, so say soccer camp, for example, new soccer balls used or freshly sanitized with all of the equipment is just within that stable cohort and not used outside of it, and no equipment is commingled, and the staff in charge of that stable group only use that equipment. I think that would be the best thing I could think of to keep from cross-contaminating anything. But I mean, if we're not able to let kids kick a soccer ball together or throw a football together, we're not going to be able to do any sports camps for the entire summer.
Thanks, Michael. So I think that would be good to note if that's allowable. It sounds like they would be adhering to, a lot of the keeping stable and keeping things within a group. Does that sound OHA approved or up for consideration?
So I think the concern is with the mixing of stable groups. Tom?
Yeah, I think that's still up for consideration. I think there's obviously a lot of nuance here, and we would certainly like it if the sports camps are able to happen to some degree, even if it's with a smaller group or with all these restrictions in place. But the most important thing here is to keep kids safe and employees and staff safe and prevent transmission. So these are some tough decisions, and it may not be the best answer for everybody, but that's the way it's got to go, I think.
Thanks for your thoughts. I think we have some other hands up I want to get to. Julie, did you want to ask your question or comment?
Yeah, I have two questions. One is there a template somewhere for a communicable disease management plan? I'm not sure that my organization is familiar with how to write one of those, but I'll do it. I just need a template of what it's supposed to look like. And then the second question is, we transport students. Are we able to do that as long as we do that stable social distancing transportation?
Thank you. Yes, there are numerous questions here on transportation if we were ready to get into that one. I don't know if Kati or Alyssa want to handle that.
Yeah, on the communicable disease management plan, I don't know, Kati, if OHA has a template or if that's something we could try to source, if that's something that exists already, if that's already a local public health requirement. And so we can follow up on that. And then Kati, do you just want to kind of remind folks of the transportation guidance that is included and see what questions people still have about that?
Yeah, so among the set of guidances that all state agencies are working on around reopening is guidance around transportation. And I've asked to make sure that guidance, based on our last conversation, includes specific information about 15 passenger vans. What the guidance will help you determine is how to protect safety and health while moving your campers, if that's what you choose to do, and then also how to sanitize vehicles. Tom, I don't know if you have a line of sight into the actual guidance document itself. That is not one that I have seen yet.
Yeah, I'm afraid I haven't been involved in any transportation discussions yet.
To follow up on that, there's been a couple questions around not just being able to transport kids, but where people are transporting to kids. If kids are coming from different counties, does that matter? If kids are coming from different states, does that matter? If they come to a stable group that's all trackable?
I will defer to the health authority on that one.
Yeah, Tom, I think that's a contact tracing question. Could you answer that?
Yeah, no, I'm sorry. What was the question?
If people are coming from different counties to one space or from different states, if they're adhering to the other guidelines, is that acceptable as long as it's traceable?
Yeah, I think that can get complicated. I think that can work. It is going to be a little bit more challenging, but I think we're going to have to think about that kind of setting, because obviously people are coming from, in many cases, more than one city or county or location to come to these camps. So that's kind of assumed, but yeah, the details of that will need to be fleshed out a little more.
And I had just kind of a follow-up that someone was asking around guidance. what has been said now is you're keeping guidance throughout the summer. But if there were going to be any changes, and I think there is a lot of hope that there might be the option for that, what kind of timeline would people be looking at for being able to get any other information? And then this information now, can it be sent out to parents and partners?
So this is Tom. I think we need to continue to discuss this with the governor's office because I'm not fully aware of how that's going to be coordinated in terms of rolling out the different phases and how they might apply to the specific guidance. So I do think that changes during the summer are not out of the question as we have new information and as we see how the pandemic and local conditions are changing.
Thank you, Tom.
So there is another person, Sabrina. Do you want to ask your question?
Hi, thank you. I wanted to follow up about and I can't even remember what it was called, I apologize, but the report, the application that you would need to do, is it an application process? Would you turn it in for approval, and how would that work? Or is it you just need to have it and document it on file?
So the application is done to the governor's office by the county itself, correct? Is that what you're talking about?
No, the plan, the emergency plan for opening your camps.
Okay, so has that been determined, Kati, that it would go, where would it go? The application for opening the camp?
I'm sorry, I'm not tracking that. Was it something from the ODE side for summer schools? An application?
Well, it was to show that you're compliant with the guidance. Is there going to be an application process? Is there anything necessary to be done by a camp and some acknowledgement or something like that that says that they would, that they're going to comply?
I would defer to Alyssa on that. I'm not aware of conversations on that.
Okay.
Yeah, at this point, no. So for those settings that meet kind of the definition of summer camp, there would not be any application for programs. So for instance, if this is where it gets a little complicated, if a YMCA were providing summer camp from 10 to 3, but also wanted to be able to care for children from 8 to 10 and 3 to 5 if their parents are at work. Those kind of odd hours, the 8 to 10, 3 to 5 would have to be emergency childcare. Otherwise, that summer camp, that 10 to 3, there is no application to be able to provide those services.
But there is going to be a communicable disease management plan.
Every program should have one. At this time, there would not be, there is no agency that will go around to camps ensuring that they're there. But it is in this guidance so that should there be an outbreak, you have everything in place to be able to work with the local public health authority and stem the spread of the virus.
Okay.
Can I ask a follow-up question that you referred to in your answer? As our summer camps are often very long, they're 7:30 to 6, and you referred to the longer windows and 2 different things. You're not going to dictate the times of the camps. That's
no.
Okay.
No, it'd only be if it's sort of an additional service beyond the normal summer camp operation. And again, we are trying to make sure that there's alignment across childcare, summer school, and summer camp guidance. And so we hopefully won't be seeing a lot of differences between program operation in those spaces.
So I did just want to note there's been a couple other questions around childcare and what you would consider childcare, and a question that came in right off the bat on on one of the regulated camps, some language there. If someone's offering before camp care, does that need to be registered, approved as emergency childcare?
And does that depend on age group?
Yeah, we've just been trying to unpack the nuance here. Sarah, I don't know if there's anything that you can share yet from the early learning division's perspective.
Sure, Alyssa, yeah, I'm here. Sorry, I was unmuting. You know, I would say I think there is some intersection, and we can definitely work on providing more clarity around that. I apologize for not having a more clear answer, but do appreciate the question, and we can get that back out to this group.
Thanks, Sarah.
There's a couple other hands raised. We have the Gilchrist Art Camp. Did you want to ask your question?
Thank you. Thank you, Bethany, Alyssa, Beth, all of you who are answering all these questions. It's so helpful. I guess just on that last question, I feel like I missed part of it. We have about 10 to 20 kids every day that sign up for pre and post care that are enrolled in the camps that run 9:30 to 3:30. So am I clear to understand that we still don't know yet if that would be allowed at this point? Even if we kept them in their same groups, because it's a much smaller group, so they would actually be in groups of like 3 or 4 and could stay within that group. They rotate through the rest of the day, or would that need to be considered emergency childcare?
Yeah, and Sarah, feel free to jump in. I think that's what we're trying to determine. It's not whether it would be allowable, it's whether it would have to just be registered as emergency care with the Office of Child Care. I don't know, Sarah, if you want to say more on that.
Yeah, I'm just trying to think about that question. I think it's probably dependent on how it operates, who operates the before and after care.
So if it was same staff, same building, same kids, would that, do we know?
Well, and perhaps age group.
Yeah.
Yeah, the age range, I believe, will definitely matter. We're still all working together to really, again, this is Sarah from the Early Learning Division, to work that out. As far as kind of the same, whether it's the same or not, so under the current order, we are recorded programs, if sort of have that designation, are required to register as emergency child care. So I just think we have some work to do to clarify exactly how that works. And again, as Alyssa said, it'd be a manner of registering versus not an operating versus not. Our guidance is aligned.
Thanks. So if I'm correct here, it sounds like they're still working out those details. So, but at this point, plan to go ahead because so much is aligned that there wouldn't be an issue in providing the services. It's just whether or not you would have to go through emergency childcare or some other protocol. Is that true at this point?
Yeah, we would say you can plan on being able to do that. It's honestly a matter of, do you have to submit a 1-page form, right? Like just for that care. It wouldn't be, do we allow it?
So if camps open next week, technically, or May 15th, let's say May 18th, and I have not gotten my certification yet for the emergency child care, would I still be able to proceed with the pre and post care since I'm in that process of applying for that while we hear more?
This is Sarah again. That has been our operating principles, is sort of to hold folks harmless as we process applications.
So there's a question here from Dave Burtz. Dave, do you want to ask your question?
Which question? I've asked about 6 here.
Well, the last one that you just posted about liability protection.
Yeah, so if we follow all the guidelines and it turns out that a parent didn't tell us the truth about symptoms or whatever, and all of a sudden a week after camp, because there's the incubation period, we find out that a dozen campers from our session got COVID-19. What level of liability are we going to have? That question's coming from my insurer. So I'm talking to him at length about what we can and can't do. And he's going, you need to get some clarification on your liability if you follow the guidelines.
Yeah, we've been getting this question a lot from child care providers as well. So the Department of Consumer and Business Services did issue liability insurance guidance regarding childcare that I shared with Beth and can resend to the group. And it's sufficient for some, not for others. At this time, the state does not have the ability, anything in place to be able to remove liability fully. It's down to the individual insurance operators.
Well, and I would think talking with your lawyer about whatever you have parents sign when they register for your camp.
Yeah, we just submitted a draft of that language to our insurer, and we're waiting for his response to that before we share it with people. We've had a lot of people asking us if we would share our language, and I'm going to do that once we get approved. As long as I have the microphone here. The other one question about transportation, all of the phases seem to be limiting non-essential travel. All of our campers come to camp brought by their parents or their group that's coming in a van. Is that going to be considered non-essential travel, and so they can't even bring their kids to camp? And then the majority of this conversation is centered around day camps and childcare add-ons and that sort of thing. We're a 5-day overnight camp, and so moving to and from cabins, even in stable groups, using restrooms and showers in stable groups, we would, like some guidance on those things when we're talking about kids together 24/7 for 5 days.
Yeah, Kati and Tom, I'll look to you. On the non-essential travel, I don't believe this would be considered non-essential travel, but that's something we can get clarity on. Kati or Tom, is that something we can add? I know that there's some restroom practices and childcare, but can we add some guidance on shared showers and restrooms for overnight camps?
Absolutely. I want to make sure that I captured all of your points. So moving to and from showers, transportation, and restroom practices. Were there some other specific things for overnight camp? Because it helps us to know what the kind of to have a better picture of the operation to be able to shape our guidance. So what else is there?
Dining is a big deal. So and the biggest question is if we only have 5 cohorts of 10. We can spread them out in the dining hall, but the recommendation is plate service. That requires a lot of extra staff and cost. And then moving around camp, how close can those stable groups be together when they go from one activity to another? And then all of our activities are group activities. That's what traditional summer camp, residential camp is. And so this requires, to even get close to this guidance is going to require some extensive changes to how we even do camp. And I don't even know if that's going to be possible.
Thank you.
I see a hand from Jake. Did you want to join in?
Yeah, just follow up on the before and after care really quick. You said that you might have to be an emergency child care facility under that. Would you be unifying some of those guidelines between the emergency child care guidelines and the guidelines, for instance, along staff? Because I know for staff for emergency child care, we've gone through that process where you have to do the 2-hour online trainings with being registered in the emergency child care background check, which wouldn't make sense for only 2 of our staff doing before care or after care. So would you be looking to unify some of those emergency child care guidelines to be more in?
Yeah, that's a great question. And I know Sarah just had to jump off, but the operating guidelines themselves, we're already working to align, and we can get clarity on the emergency childcare requirements for staff and potentially being able to defer to kind of existing background checks and things of that nature, training requirements and such.
That'd be great, because I think camps talking about that are just talking about kids getting dropped off early because their parents have to get to work. It's like exactly the same program, just
an hour
earlier or an hour later. So
Yep.
it seems like we wouldn't need to do extra emergency childcare things for that, at least in my thinking. But,
Yep. No, that's helpful.
And just a quick clarifying, is that emergency childcare application still open? I had a question about that. And I don't know if you'll know, Alyssa.
Yeah, and Sarah just jumped off. So right now it is limited to licensed childcare providers, but we are looking at about adjusting that in part because we're unsure of what the demand is going to be for childcare generally, right? As more parts of the state and more sectors start returning to work. But as we start to figure out how, if at all, emergency childcare plays a role in summer camp guidance, we will adjust eligibility accordingly. We're definitely not going to try to set somebody up to apply for something they're not allowed to apply to. So we'll make sure that that's in alignment as we move forward.
And there is a raised hand from Len from Catlin Gable.
Thank you very much. I have a lot of questions, but I'll just stick to a couple. Number one, do the kids and families need to submit new medical background checks of some ilk? That's number one question. Then the follow-up or second question has to do with international students and if there's any protocols that are different. And the final question is, adults who come to pick up, for instance, or drop or pick up, are we doing any precautions or whatever with the families who might be drifting around our sites? Guardians, nannies, parents, big brothers and sisters, etc.
I will defer to OHA on that.
I'm going to let Tom Jean answer about the first question. Anything different for international students? I think the guidelines begin to talk about taking measures to have pickup and drop off be physically distanced and also not inside the camp facility if it's an indoor, and in a designated area if outdoor. And then thinking about how to take a camper out. So I think we're starting to, we've tried to articulate that. I think we can look back at that phrasing and see if it can be strengthened or made more clear. And then Tom, the question about international.
Yeah, it's an interesting question. I think we haven't addressed that in the guidance so far, but for international students or campers, I think it may be possible if they have been in Oregon or at least in the US for 14 days without symptoms prior to entering the camp. But I think we're going to have to figure out the specific details of that.
Just to drill down, not on international, but just all our students and campers, will they need an enhanced sort of medical background form to be done prior to their coming to our programs?
Again, this is Tom. I don't have a good sense yet for what the current background forms look like, so I think we need to discuss that and then see, but I'm not sure that we would need any additional documentation. I think it's going to be more general recommendations that kids who are sick are not coming to camp.
Thank you.
And then I see a couple of other raised hands now. Anne Morrison.
Hi, thanks. I just had a couple questions around wilderness programs. So I work with Outward Bound. We run week-long to 3 or 4 week-long wilderness expeditions, backpacking, whitewater rafting. And I'm curious if all of the same guidelines are going to apply to wilderness groups as they do to front country settings. Our groups are pretty insulated once they leave and head into the backcountry. So I'm curious about the physical distancing guidelines. Sleeping in tents or tarps, do they still need to maintain the 30 inches? Some of those things I'm curious if they still apply.
Thanks for the question. Is this due to our great expertise, Alyssa or OHA or health perspective want to weigh in on this one?
This is Tom. Well, regarding sleeping in tents or other settings that are a little different, I think the same spacing is going to apply. I don't think that alone gets you out of that 30 inches and head to toe rule.
Okay, and I had seen some other questions, thank you for bringing it up, about kind of outdoor activities, and I know our nature friend here asked about bike riding. Is there more specific guidance on being primarily outdoors? Like you said, being outdoors doesn't get rid of the guidance, but is there any wiggle room in some of these outdoor-based camps and activities?
I'm also curious if it changes with the length of time the group has been together without outside influences. So if they've been together for more than 2 weeks, does it change, you know, backpacking together for 14 days or 21 days or something like that?
This is Tom. That's a good question. You know, we know the incubation period of the virus is about 14 days at most. However, that doesn't mean that after 14 days you're out of the woods, because there could be transmission at some point after the first day of camp, you know, asymptomatic transmission. So in general, we'd be looking more towards at least 2 incubation periods, which is getting up towards a month or more. So for most camps, that's really not going to change things. And then another question was what about outdoor recreation and biking and things like that. You know, all the same things are going to apply with the 6-foot spacing. And I don't think there's a whole lot of other differences, but certainly being outside is generally safer than being in an enclosed space.
And thanks. We've got a question here from the Salem Ropes course, and I saw you had mentioned this earlier as well. If they've got groups coming into them, they don't have people eating at their facility, and kind of to the question of people having guest speakers come to a program, how does that factor into a stable group situation? Any guidance from OHA, or I feel like we may have lost a few people.
This is Kati. I think I need clarity. I'm not that familiar with ropes courses. Are they groups that are there for shorter than a day?
6 hours is one of the examples given here.
Mm-hmm.
So it would be just for a portion, and they are not providing food. They may use bathrooms, but the bathrooms would be cleaned daily. There was another question around that, around how frequent does frequent cleaning need to be?
Mm-hmm. And then the question of the course itself and sanitation of the course.
So that, I guess, would be a good, would they be expected if people were touching all of the ropes? Are they wearing gloves? Is that kind of a consideration that would be available? And James or Salem Ropes, did you guys want to jump in here? James has more of a sanitation question on ropes use.
Yeah, I can jump in. I think the struggle is we send sets of 10 kids through a single ropes course, and they're touching a lot of stuff on that course, and then we send another group of kids through. We can sanitize between each group of 10, but we can't sanitize between each kid. Just not sure what best practice is there.
Yeah, that's one of these tougher calls, I would say. I mean, it's ideally you don't want kids touching the same surfaces that another kid has just touched, even if they're within the same stable group. And obviously that gets to be a real problem of practicality. As you said, it's just not reasonable to sanitize it between every kid. So whether there's some way to mitigate those concerns and minimize any risk while still allowing it to happen, I think a lot of these are going to come down to the logistics of the specific situation. I'm not sure we can provide detailed guidance for every single situation, but I think that something like a ropes course, and that probably ties in closely with the sports camps, with balls and bats and other things that multiple kids may be touching. That is, it sounds to me like an area we need to do some hard thinking about and come up with some guidance for you all.
And so there are what, 6 hands here, 5, and there is one question that asked for clarity on childcare. So maybe.
Yeah. Anne, did you still have a question? Anne Morrison Brown.
No, I'm okay right now. Thanks.
Okay. Jessica, did you want to go ahead and ask your question while we're finding others?
Yes, thank you. I was just wondering to revisit on the transportation answer. Did I hear you guys say that you haven't finished a document on what transportation looks like, but you are in the process of doing that? Transporting kids?
Yes. So my understanding, this is Kati, my understanding is that the health authority has drafted guidance for transportation sort of as a setting. I don't have a line of sight into that. So I don't know where it is in process. And Tom had reported that he doesn't have a line of sight into it either.
Okay, thank you.
So there was a question here from Stephanie Powell. Can we please get clarification on the need to apply as emergency childcare? If a program is registered in Oregon as before and after school care, are they required to apply as emergency childcare in order to run a summer program?
Yeah, so we've lost Sarah, so I've lost my early learning division lifeline. So this I think is part of the general clarity and process that needs to be developed for all non-licensed programs. And so we will get that clarity out to you as part of this guidance and make sure folks know the difference. Yeah.
So I'm gonna go with, is it Sherry? Did you have a question you wanted to? I know I've seen it come up several times in the chat box, I think. And if you're able to unmute, no. How about?
Got it.
Okay, thank you.
Okay, sorry about that. So this is all very specific to summer camps for children, but May 15th, camps can open. So adults can come to camps. We do a lot of adult retreats as well. Does that mean we can open for adult groups following guidelines May 15th? Or are there, a limit on the number of people, or it just depends on social distancing and the amount of space we have? That's something we have to determine. Or that all the people are coming from one area versus multiple areas. Are there clarifications on this?
Yeah, this is Alyssa. Kati, please jump in. I think we will get clarity on sort of, again, that definition of summer camps and whether / how this guidance would apply to those groups. I don't know, Kati, if you have any other thoughts there.
No, I think it's helpful to know that that's a question and we do need to address it to know what guidance goes with what.
Mm-hmm.
And one thing to keep in mind about groups such as this, they're a fairly closed group. I mean, they come, they socialize with each other, of course, the obvious social distancing practices in place, but they don't go home at night and they don't, go into the community and that sort of thing. So they're a stable group while they're here type thing is the scenario I'm talking about.
Yep,
thank
you.
All right, let's go to Sarah Aguilar with your question, your hand up.
Yes, thank you. I work for a church and we do a vacation Bible school. We have youth group programs and mission trips. Are those things that we can start doing now if we can follow the guidelines, or is that still on hold because churches aren't meeting yet?
It's a great question. We will get clarity on the location piece. I don't know, Kati, if you have any other thoughts there, we can clarify the location for these summer camps.
No other thoughts.
But I think it would be great to have a little guidance, because I know there are many, many church camps that offer day camps during various times of the summer. So thanks for the question, Sarah.
Yeah, and so contacting churches for those, they're usually week-long camps. So we'll have to do some outreach.
Yeah, I can make assumptions, but don't don't want to overstep. So we will clarify and make sure that is clear to everybody.
Great, thank you.
Elizabeth Gillespie, do you have a question here with your hand up?
Yeah, I'm just curious on the emergency childcare. So my question is, if you're running a summer camp from 9 to 3, and then you have a before care and an after component under the emergency childcare, how do you keep your stable groups? Are you expect then that you're stable, even if all 10 of your kids in your day camp stable group don't go into aftercare, do you still have to keep those same stable groups in aftercare? Or are you saying under the emergency guidelines of childcare, we can now have different stable groups?
That's a great question. And we'll find clarity on that as we determine who would actually need to be emergency childcare. But I think that's a great question about how do you maintain stable groups before and after those sessions. So we'll include that in this guidance.
Perfect, thank you.
Yeah.
So I have a question over here around specifically dance studios. And I think the bigger question, or the making it relate to other people as well, is the possibility or plausibility of places that host camps or very short classes for youth. Does that fall within the day camp definition?
I don't know, Kati, if you have thoughts based on the definition that we're working with now, or if that's something we need to get more clarity on.
And that whole
I'm reviewing
allowance.
the definition again.
So I think it's the question of churches as well, right? The allowable spaces.
A question that we would follow the governor's office leadership on, like what sectors, how we're defining those and what falls in.
Yeah. So we'll run that down.
Cameron, did you want to ask your question? I'll help unmute you. Do you want to go ahead?
Can you hear me?
Yes.
And I may have missed this earlier, but first of all, thank you for all of your help and for everyone who's contributed. But I may have missed this. It's kind of in relation to the ropes question. There was the addressing in the guidance of the sanitation between each child. I mean, I guess my question is, that's going to apply to essentially any surface. And that was kind of, I know this came up earlier, but the shared bathrooms and showers is the expectation that if you're going even with your stable groups within those, if they're using showers in groups, or is there a change to that guidance if there is an isolated shower within a stable group? As an example, with a cabin of the stable group of 10, if they have a shower that's exclusive to their cabin, is there different guidance for that than there is group shower houses? That would be just a clarification I'm looking for.
Yeah, Kati, I don't know. I think that'll probably be part of the restroom shower conversation. I would imagine.
No, it's helpful to know that that's some of the context. It's clearly been a while since I've gone to camp.
There's been a couple questions coming up around the use of masks. And so I know we touched on this briefly at the beginning, that masks are recommended for children and staff. And is that expected to be all day, particularly in resident camps or overnight camps? And then is a camp supposed to provide those, or are kids supposed to bring those?
On the providing them, I don't think I think that is a decision we would leave camp to camp. So if a camp is able to provide those, or whether they require that the families provide them for their children, I don't believe we will get into that level of recommendation. But Kati or Tom, do you have any thoughts on kind of the duration of wearing the masks or the settings?
Hey, this is Tom. The duration, you mean when during the camp? Because I think it's a general recommendation currently, other than sleeping at night.
And there is questions on running camp and having kids, or I guess this would be the same in sports or activities. Would that be expected to have youth keep their masks on while participating in physical activities?
Mm-hmm.
Yeah, and that gets to be a little tricky if, you know, kids have asthma and other issues, and if they're running, you know, I think that's a point that needs to be clarified. So I don't have an answer right now.
I'm going to guess this is Jeremy Lewis. Do you have a hand up for a question, or Lewis Jeremy?
It's actually Jeremy Lewis. Thank you. I'm a staff member with a high altitude running camp in Eastern Oregon. We're in a wilderness setting. Sleeping quarters are in the form of military tents. And I'm wondering if the spacing of 30 inches between beds is going to also fall for tent style sleeping arrangements.
This is Tom. Yes, we were thinking that would apply to any sleeping situation.
Okay. All right. So that's my first question. Now, our eating area, dining area is outdoors. We utilize folding tables, folding chairs, things of that nature. Any requirements in terms of what distancing should be between campers while sitting and eating?
Sorry, so what is the question? You're talking about outdoor eating?
Yes. Our campers eat their meals at large folding tables. Wondering as to what requirements there might be in terms of spacing between each camper while seated and eating their meals.
Yeah, so it would be the same general recommendations as any kind of the food service or eating. So 6 foot spacing would be the rule there.
Okay, so 6 foot spacing, excellent. And then last question I have is in regards to transportation. Most of our campers utilize bus transportation, and it's cross-state, could be from Portland, Salem, or Eugene, going over to Eastern Oregon. That same transportation is utilized on a daily basis during the camp. We're talking 5-day overnight style camp. So what is the current requirements on number of passengers in a standard 84 passenger bus? Are we going with the 6 foot distancing again?
Yeah, that'd be the default. Kati, I don't know if anybody has discussed this to your knowledge. I haven't heard in any of our guides yet recommendations on kind of buses or what's the maximum capacity other than trying to maintain the appropriate distance.
In terms of how many passengers, yeah, I mean, I think that's what I've heard as well. The transportation guidelines that we keep referring to will also, to my knowledge and understanding, include sort of sanitation guidelines for those vehicles as well. But the optimal is to, 6 feet of distance is the recommendation for physical distancing, sort of irrespective of setting.
Okay.
And it's a question that schools are going to have to answer for summer school. So Kati, as the Department of Ed develops their transportation for buses, it's probably alignment would be good.
Yeah, we're working closely with them.
Great.
Okay, so Kati, just real quick, these transportation guidelines you're referring to, where are those located presently?
Those are in draft within the health authority, as far as I know, and I'm not sure where they are in our process. I haven't been involved in those particular guidelines.
Okay, I just want to make sure I didn't overlook that in the document that was attached to this. No. Okay, thank you very much for your answers.
Thank you. We have one more question, or one more hand up from Alyssa, it looks like, from Campfire Walani.
Hello. I'm curious about testing in the state of Oregon, and oftentimes when you have a camp program or any other program, you can be, a doctor's order is currently required for COVID-19 for a test. In other situations, like with a TB test or certain vaccinations, a doctor will just write those because they're required for participation or employment. And I'm wondering if the state of Oregon might be advocating for tests under these circumstances so that we can get to a point where we might be able to mandate testing for our staff and have tests be able to be administered, and the same for our campers.
Yeah, this is Tom. So that's a good question. There's a lot of interest in testing as kind of a screening tool. And at this point, I want to highlight that we at OHA are not recommending that testing be used for screening. In other words, testing people who don't have symptoms or any known recent exposure to somebody with COVID-19. There's just not a lot of usefulness for a test result in those settings, because the sensitivity of a test in somebody without symptoms is quite a bit lower. So if you get a negative result, that doesn't really prove anything. So in general, and at this point, we don't have enough tests to test the entire state. So we are focusing on testing of people with symptoms, and then, of course, isolation and quarantine of people who have a known case or who have had contact with a known case. Does that answer your question?
Totally. Thank you.
Thanks. So I just want to be mindful. It is the end of our hour and a half. Wow, that 90 minutes flew by. I know that we did not get to everyone's questions, and there is still a lot of uncertainty. And I appreciate everyone, Tom and Kati and Alyssa, for answering all these questions. And Cole, thank you for sharing your ODE insight as well. We will make sure to share out everything that has come through here. And like Alyssa mentioned, she'll be accepting feedback as they are putting together these draft guidance. If you got the invitation, then I should have your emails. So anything that comes out, we'll make sure to get to you. And if there are more questions that we haven't answered, make sure to put them in the chat box right now, because we will save all of those and make sure they get sorted and sent along. The recording and slides will be sent out to everyone who participated and anyone that registered. So again, I'm sorry if we didn't get to your question, but I hope that there was a little bit of good news that programs or camps will be open this month, and we all will have a chance to interact, though not with as many people or in the same way, but I hope that we can make this a good summer. So again, feel free to put your questions here if we didn't get to them. And thanks again. Alyssa, was there anything else that you wanted to share before the end of our time?
That's it. Thank you again for your feedback. Yeah, feel free to send me an email by noon tomorrow. We are on a pretty tight timeline to make sure everybody has what they need before May 15th. So appreciate all of your thoughts and feedback, and I gotta jump off, so thank you.
Thanks so much.
Thank you. Thank you.
And if anyone is still on reading through the chat box or answering their questions, you're welcome to unmute yourself and ask any questions of those of us left.
Thank you.
Thanks so much.
Hello.
I have a question. I don't know how to raise my hand on this thing. I don't see the hand raising. Can you hear me?
Yes.
Great. So the meeting this morning with the mayor, or I'm sorry, the the governor's presentation at 11 o'clock. Thank you. Governor Kate Brown had stated that she wanted once we start to open in certain areas for camps or counties, that she didn't want people traveling across into other regions to prevent additional spread. How does that apply to summer camps or summer schools when, say, for example, you're in Portland and your student is coming in from Vancouver? Is that going to be allowed? Is there going to be restrictions on that?
I think that's a great question that I don't know that they have the answer to. I think because what I also heard during her press conference was these are what we're expecting, and they're not going to police people to say you're clearly in the wrong city or county and you can't drive through here. So there's not going to be like a martial law enforcement of that recommendation. I think it will be a lot up to those people hosting camps to decide if you want to, if that's a good option, right? If it's a stable group, if you can trace down in case there was an instance. But I think that is a question that we'll pass along to make sure they note in the guidance of, will it be allowed, recommended, what's the language they're going to use on having people from different counties and states participate, kind of coming together or not. Does that give you an answer of some sort?
That's great. Thank you. As for now, and then I have one more question. So we operate under Early Childhood Learning Division licensing, which I guess that means we can also work as an emergency operation if we file the paperwork. My question regarding that is early childhood learning under emergency childhood operating guidelines are much more strict than what's been discussed. I mean, granted, they're similar, but then there's a lot more other little facets in there. Do we know or have any idea that if that there are going to be any changes to the emergency childhood operations within the early learning division or anything like that? Is there any updates on that?
I don't know for sure, although I have heard conversations that they are kind of revisiting, especially because of the school age conversation as well. And so I think that was what Alyssa alluded to, is they're trying to get the best guidelines as possible in place, but I haven't heard particularly any dates on if that is going to change and when.
Okay, because my concern is that it's that, for example, in those emergency childhood operations, it states that, like, for example, kinder and under, they want you to stay with your regular childcare, the one you're using right now. If you're going to open a new one, they want those kids to stay separate. So that's an issue. So because then we lose like half our students in our particular camp that operates under early childhood.
I think that I'll make sure and flag that for if they have new guidance and how soon we would expect it.
That's great. Also, are we going to be requiring screening of staff before they come in, like temperature checks and so on?
And I think that was something they alluded to, that will not be required in any form. It may be recommended, but that would be up to the program's discretion. They don't have in place yet the expectation that would be implied. In our last call, Alyssa did note that childcare is on the list of essential workers who could be tested by public facilities. And so making sure that summer camp staff was also grouped in so that they could actually access public testing. So I think it's another we'll have to follow up.
Okay, thank you very much.
Mm-hmm. Is Kim, that wasn't Kim Sinclair, I don't think.
No, that's me. Thanks, Bethany. I also didn't notice the hand thing. So there we go. I can get rid of it now. I was looking down somewhere else. I just want to be clear. This is the Portland Waldorf School, and obviously our our school closed back in March. But I run all the camps, and so I'm hoping to get this started. But it wouldn't happen until late June. And we haven't applied for anything, although we are a certified registered childcare facility. So the way I'm understanding it is, unless we're doing the pre-care or aftercare, we don't need to apply for anything. We can just go ahead, follow all the guidelines. We don't need to register anywhere in order to do summer camp.
I think that's a good and kind of tricky question, because I don't know that they've completely answered that themselves on what counts as what. And so I think referencing the specific language in the guidance document for now, but flagging it for them to make sure that they understand if you are, because that was a question we didn't really get to that came in our kind of registration process, is if you're a licensed center and offering summer camp, do you adhere to childcare, or do you adhere to camp protocols?
Okay.
And I don't know that they've answered that, but I will make sure that they do.
Okay, and then the answers for these things, if we registered for this Zoom meeting, you've got our information and you'll send those updates to us?
Yes, absolutely. We'll make sure anything we get, we share with everyone.
Okay, great. Thank you. I appreciate this.
Yeah. And then Gilchrist Art Camp, you have another question. Your hand is raised.
Yes, thank you. I think I understood this right, but I'm so blown away that I just needed to ask again that it sounds as though, as an unregistered, child care facility, like I just run a summer camp, that even if our county is not open in phase 1 or phase 2, that as of May 15th, we can operate our summer camps. Is this correct?
That was what I heard as well.
Okay. It feels weird being able to send out a mass email and say like, hey, summer camps are now open. And I know parents will want information on, is that true? Yes. It's crazy.
I was surprised as well that, yes, that was the reason. And that was one thing that came up that is so hard to hear and make okay with, is that they're trying to make this a good for everyone for right now. And so someone brought up in the chat box along the way, having this in place means that there will be more cases that come up of COVID-19. And we just, are we okay with that? And this is their best attempt at trying to mitigate the spread beyond what would be manageable. So, because yes, you can offer camps just like there is emergency childcare going on in all of the counties across the state. And so I think that's the idea, is that if they're keeping it small and stable enough, it can operate no matter what your other reopening phasing is looking like.
Right, which is great. I mean, it's awesome news. And I think as long as we adhere to all the cleaning and keeping kids in groups of 10, I think it feels really safe and, offers all the parents that have been desperately emailing this opportunity for them to work again and to get their kids out of the house. So thank you. Thanks for the whole meeting. I appreciate it all.
Yeah, thanks for joining all the questions. Daniel, did you want to ask your question?
Yeah, so you guys are still you're gonna kind of take this conversation and go back and review and then come up with final guidelines.
And I'll say that's not us, but the Office of the Governor and Oregon Health Authority are going to be taking all of the questions and comments that they heard to hopefully then provide final guidance. Yes.
Okay, so the way that I interacted with this conversation was less as like informational for me and more as like an opportunity to give feedback. So I felt like it was a little bit more, people are interacting with more as like informational and getting direction. And I'm a little bit more like interested also in like continuing to, while there's room for feedback to give, to also, the parts about, the group size numbers, and then having, managing at 10 kids, a lot of like my model, the model for other people, that becomes like on the surface that's unworkable. And so hopefully people can be creative and figure some things out. And so just kind of like just as feedback to continue to be creative and innovative about like, how can there be nuances so that's actually workable financially and with the other safety things that go on and staffing. So just like that would be my hope, is that there's continued innovation about how to do that.
I think those are great comments, and I would agree. I hope that they heard that there is still room in here for improvement, particularly going forward, and some of the comments around there would be a lot of happy camps and families if there were some different guidelines that came up as we progressed in the summer and reopening process.
And yeah, and less from like just happiness, also just like there's pragmatic realities about like other things will become, you could easily argue in cases where other things could become less safe because you've changed models to kind of fit the COVID model with a 10-person max. Like you could easily find lots of exceptions where you've made other models, they've been creative to accommodate that, and in so doing, they become less safe in other ways. It'd be easy to imagine all sorts of scenarios where that's the case. So just the flexibility would provide potentially more efficacy for programs that are dealing with like, well, do I make it more safe for COVID because that's what the state's saying I have to do, or or like there's other things I know for a fact that also that, I've developed this in a certain way that makes it like, so it's really workable, and I might have to sacrifice these things to fit the COVID thing, so that's the part that I want to campaign for, is just that not that they give up on, some sort of guideline, but that the flexibility does have a real impact on not just finances for people and people having like access, but it has real impacts on safety issues that we can't get into in depth here. So I just want to, campaign for like, that's a real thing. I think that's something that gets lost in the shuffle of being concerned about COVID. So, while there's time for feedback, that's what I want to offer. And the other question I had was, the masks, I didn't get clear, like it just sounds, so masks are recommended. Is there any more details? If I might have missed it, is there any more details on what's expected with masks?
I don't think you missed it. They went over it really quickly in the slides that masks are recommended for use and staff are expected to wear them, but again, it's not a requirement, like they wouldn't shut you down. And they're recommended for children over the age of 2. And that was really all. And so it's kind of that flexibility.
Okay.
And there wasn't more that I know.
Okay.
So we could ask though, if we want there to be more, but at this point that was just a recommended use.
Yeah. I mean, I think just the guidance, the final guidance, like, so that if the best that it can fit, yeah, that's not all that. So, yeah, thanks for answering those things or listening to those things.
Thank you for sharing. It's all being recorded too, to share back. So
great.
And then Harlan, did you have a question or comment you want to share? I think you should be unmuted. No?
Okay. Okay, I've on the camera here. How do I get the camera on? Okay. All right, yes, let's go to masks. I have ran the Steens Mountain Running Camp for 46 years. This would be year 46, started back in 1975. Can you hear me?
Yes.
Anyway, one of the things that we do out there, we train high school boy and girl runners from a variety of different schools throughout the nation. 12 different states are planning on coming this summer, represented one from Hong Kong. And it seemed to me like there is, our base camp is located on 160 private acres. It's a base camp. It's a remote camp out in the middle of beautiful nowhere. Kids have a great time in regard to just running. One of the things we do, a couple different things we do out there in the training philosophy is they go on a 28-mile hike and run in a beautiful place. The question I have is, must they wear masks on that 28 miles? I mean, sometimes you see them wearing bandanas just to keep the dust out of their nose. And then at times, obviously, they're drinking water. They're hydrating like they should. They're putting water sanitation tablets in their water bottles during various times, and so forth. So we have a very unique situation out in a very beautiful remote eastern Oregon in Harney County, which I understand only has one case of COVID. And that just happened a couple weeks ago or so. So the other question I would have is the fact that when we have kids that are already signed up, we filled in January. We filled 2 one-week sessions in January, and we fill with 170 kids, and we could have 500 more. With 46 years of reputation, it gets out there. We have kids that came to camp back in the 1980s that come up to camp. They love the beautiful Steens Mountains. Something beautiful happens when you put water in a desert. So we are surely hope that we can work on flexibility. I can see how the cohorts at 10 on 160 acres that probably would help. You probably could have several cohorts of 10 on 160 acres running over 170,000 acres of Steens.
Yes.
So again, we're an outdoor camp. There's nothing indoors about the camp other than tents. And one of my staff people called or faced you earlier and talked about tent space, and I can see how that would work. I mean, you're looking at from what I heard earlier, 35 square feet per. That's kind of what you want between campers, and this might mean that we've got to rent 2 great big circus tents and sleep 6 feet apart, with the sides rolled up for ventilation.
Well, and the resident camps, you'll want to make sure that when you're looking at the guidance, you look at the resident camp guidelines. And so that was 30 inches between beds and sleeping head to toe. So if you were on the floor of a tent, then they would have to be 30 inches apart. And with like other tent space, or if you had them eating in meals, that would, again, you would just be trying to keep that 6-foot distance. But I do want to just mention that this is the best of intentions, trying to mitigate expanded spreading of this disease, and there is the, like running around for 28 miles, you could tell the kids to wear their masks, and if they don't, what are you going to do? There's not going to be anything, any repercussions for you if a kid didn't follow the rules. So that's something else that I think we are trying. They're trying their best to come up with things that work. But I appreciate that you are definitely a different kind of camp than many that are happening, and so I would hope that you do find that creative, flexible way to make that work for your camp.
Yeah, and the other thing is, it's a long ways from Portland, Eugene, and Bend, and a lot of parents opt to, place their kid or young, we're talking teenage boys and girls, are age 13 to 18, nothing older, nothing younger, and they opt to put their kids on the bus. It helps them, and a lot of coaches actually bring their teams in vans. I don't know how that would work with, let's say you've got 10 kids out of Wilson High School, or for example, we've got a team out of North Salem High School and South Salem High School. and they might want to bring a van. And I don't know how a coach, because normally we have 8 or 10 coaches who also volunteer, and part of our camp bring those kids from those high schools in a van and then bring them over to camp. And I don't know how that would work when you have let's say 8 kids from South Salem High School with a coach driving them over. How would that work?
I think that's a great question, as they're still trying to figure out what transportation guidelines look like. We'll make sure you had shared some of that with us in your kind of registration form, but if you have more, we'll take everything that was shared here today and send that along to feedback for them as they're developing those, because I think it is important for them to consider kind of these special cases and what would work. So I appreciate your sharing.
Yeah, it's when I look at the camp guidelines and so forth, all of a sudden I don't see us in there because we're such a different camp, and I guess we're one of a kind actually in regard to years operated. The other big worry I have is I've got several college age runners. They're from Stanford, Dartmouth, Gonzaga, University of Oregon. They're all campers who came through our camp that we now have hired as camp counselors. Each one is in charge of a certain group of girls or boys.
Garbage.
Our help, are you there?
Yes.
Our help has, let's put it this way, our help has been committed for a long time. Our coaches, our counselors, our cooks, our bus drivers, have been committed for a long time. My big worry is that a lot of these college age counselors are counting on the 2 weeks or the 1 week worth of salary they're getting, and so they're just hanging on, waiting to see if we are going with camp or not going with camp. And so I don't feel real good about my college kids, and I don't and our bus drivers. I've had my bus drivers with me for years and years, and they're not getting paid at their school districts. They work up in the Reynolds and Gresham school district, but they drive the buses from there down. And these ladies are counting on that bus driving money as part of paying their own rent. And what I see right now out that's being offered in regard to loans and so forth, and that's not me, I don't think. Anyway, what I see is there is no way to get, if we cancel camp, how we can take care of those people, take care of my people in regard to that. The other thing is, this is a big hit to Harney County. It's already, Harney County is already is an area that is hard hit, and this camp brings in a lot of dollars to the Harney County economic part. So anyway, I'm just hoping that we can figure out a way to make Steens Mountain Running Camp work for the kids, keep them safe, keep our staff safe, and make this thing go. It starts in the middle of July, so I'm just hoping we can. And I want to say thank you very much for listening.
Yes, thank you for sharing, and we'll make sure and share your feedback and hopes. Yes, we hope as well that everything is able to open and camp will continue. So
I wish I knew how to work my my video. I would have loved that. But you're just gonna have to listen to my voice. Thank you.
Yeah, thanks. Jake, I did want to get back to your hand raised.
Cool. Thank you.
Thank
I
you.
just wanted to clarify really quickly. So we operate day camps. The parent organization's a church, but we operate day camps under the church for 11 weeks. Actually, it's a full summer of day camps, and so it's basically like you would find a day camp just in a church setting. So I would classify that under just an unlicensed childcare facility. But when this first started, we went through, it's not, the one form process. It's a 3 or 4 week process to get the emergency childcare certification done. At least that was, our experience. And so what I'm finding is we're actually just got kids to open the emergency childcare facility this Monday, but the regulations don't aren't the same. And so it would make more sense to me to dump the emergency childcare certification and just run as a summer camp as of the 15th. And so I'm wondering if there's been thought put into that as far as, there's, 300 summer camp directors that just logged off and took their marching orders to go get summer camps open next week, people who are relying on it for the income. And so, I'm wondering if there's any benefit to running an emergency childcare facility at this point, or is it worth just calling everything summer camp and rolling? You know what I'm saying? It's just, it's everyone provides childcare. Everyone does activities for kids, gives time for the homework. It's just what you call it, And so I'm wondering what the benefits of emergency childcare are at this point, and if we should just, because our summer camps are scheduled to start anyways, so we'll just run as a summer camp. But
honestly, I've seen a lot of conversations today and over the last couple of weeks around that as this came out, that it's looking different, but kind of the same. But now it looks completely different in that you can start whenever you want,
which is great. I'm thankful. Appreciate
yes.
it.
and so I don't know that there is honestly a lot of benefit to being a childcare site unless you were planning to have a fee structure that you would have parents use employment related childcare.
Okay.
So if they were going to be using that, then you would want to kind of go through the process so that it was an easy enough childcare providing site. Otherwise, it sounds like camp is kind of.
Camp's great then. So I wanted to make sure I wasn't missing something. So it's
not from what I've heard.
I'm glad we're opening back up, and that's great. I just wanted to make sure before I go and say, hey, we're running summer camps, not emergency childcare, that I didn't miss something there.
From what I've heard thus far, summer camp is a good to go sooner rather than later.
Okay, great. That was just, I wanted to make sure I didn't today.
And we'll make sure to send any guidance that's final along.
That'd be awesome. Okay, thank you very much. Appreciate it.
Mm-hmm. Are there other questions, hands, or feel free to unmute yourself.
I had a question.
Yes.
And I'm sorry, it might have been, I didn't realize you were all still talking. I just looked back, I heard something coming through my speaker. I'm like, oh, they're still chatting. And I'll just ask one of the questions that I had jumped in at the last moment here about teens. And we usually have a group of 12, which will now be 10, and 2 semi-adults are adults, and then 1 teen. Is a teen considered a child for the purposes of that 10 number?
I think that's a really good question. We asked around high school interns in our last call, and they said we have to flag that for discussion because they didn't have clear guidance on it yet.
So there's not guidance on that yet. So it might be if you had a teen volunteer, you might need to go down to 9 kids or just skip having teen volunteers.
Yes, you could, and it would depend if they, were getting paid or had an internship that you might be able to, put them over.
Our teens don't tend to get paid or have internships, but we have, high school, college students who have internships, but this would be like a true teen, like a 13, 14, 15-year-old who's not a college student yet. So so there might be, do you think there'll be some clarity on that at some point?
I'll put it in our follow-up questions around.
I think a lot of people have CITs, like, counselors in training who are young people. And people are going to want to know, what do I do with this youngster? Can this person be involved or not? Okay.
I'll make sure I put that on our list.
Okay.
Thanks for asking.
Yeah, thank you.
Other questions?
This is Dan again.
Yes.
And once the guidelines are in effect, I contract with lots of different municipalities, and will they is it the kind of thing where these are the guidelines for everyone, but then will municipalities be able to make their own guidelines in addition, or is this kind of like what it is and this is what everyone's expected to do, or do you know how that'll work? Because for me, it could potentially be, the the state guidelines on top of, 15 or 20 different cities doing their own kind of version of that.
Yeah, so I don't know exactly. The way that I've heard and interpreted is that this will be the state guidelines, but it will be kind of just like the counties are opening up in their phases. It'll kind of be up to their discretion on whether like a municipality would have a different expectation, especially if you were using their space or needed to have a sort of like a contract with them that you were able to show that you were meeting all of the guidelines, I don't know that anyone's going to be more strict or not, but I don't think that I haven't heard one way or another if cities or municipalities are going to say this is good, but we want to do one step above that.
Yeah. Okay. I mean, in my experience, there are sometimes staff at different municipalities that are more or less vigilant and kind of want to be, they want to stand out as being like particularly vigilant, so that can happen. So I'm just trying to be prepared because that makes things, obviously, for me, that makes things, like more complicated and adventurous. So I'm just trying to know, just trying to get a sense of like, if it's what the state says goes and like everyone else does that, or it sounds like there's still, municipalities will still have the freedom to kind of do extra stuff that they feel is necessary.
I think so, just like the state parks closed and then it was really up to the regions, the cities and counties to determine when and how they closed their parks. And so I think about it in that way of they have, over their jurisdiction, another layer of authority, I guess.
Okay, great. Thank you.
Yeah.
Well, since you're still here, I have another question.
Yes.
And that is a little bit more about the whole stable group thing, and I think a lot of camps may have like something where the lunch care or the pre or the post care is just a mix of different groups. So I'm wondering, for example, like a lunch care, which is in the middle of the day and it's between, half-day camps, and it might actually be usually a bunch of different kids from different half-day camps. If that is a stable group and there's not like a drop-in component, in other words, you have to register and say, I'm doing lunch care for the week. Could that be considered a stable group, or is that still like a mix? That's mixing in of, in reality, it's mixing in of kids from different groups. You see what I'm saying?
Yeah, and I can imagine they would see that as a mixing of stable groups.
Yeah.
And yet I know that they're working on trying to get food as its whole kind of thing, because there's waivers right now to do food like through schools, and that allows it to be done differently. And so trying to figure out if those different procedures that would allow more flexibility in kids getting food and not having to be physically present sitting at a table with one another, if that's going to be possible throughout this
transfer
summer.
over. Because we don't provide food, but we would, it's sort of that intersection where some kids are coming before their camp, some kids are staying after their camp, and it really makes it or breaks it for some families in terms of their childcare.
Right.
But I can see how, so that still needs to be clarified, it sounds like.
Yes, and that would be a good to flag for them. And there might be questions around supervision. Are you saying that you are supervising these kids during that time? And can you keep them in their stable group from the morning before they go to the afternoon? Can you keep them separated enough? There would be lots of kind of questions they would probably.
Okay. Should I type something into the chat then, would that be good? Or
you sure can, yeah.
Okay.
And then.
Okay. And then one other question is just I brought up the mask thing before, and I'm just envisioning like upset 5-year-olds who are already upset at you, and you're trying to make them wear a mask, and then they refuse to wear a mask, and it becomes this huge thing where they hate camp because, Johnny is making me wear a mask. I hate nature. I hate camp. I don't want to go, Mom. And then you have the other parents who are like, everyone must wear a mask, and if they don't, we're all going to freak out. I'm just trying to I just don't even know where to go with the whole mask thing in children. It's hard to imagine, even though I'm an advocate of like safety and people wearing masks, but with children, I'm just trying to envision how I could keep 10 kids with their masks on when it's hot and they're irritated and they need a drink of water and they have to bring one back every day. And I don't want to, and I'm not into like providing thousands of masks which get littered around every day. I just,
yes.
I don't know.
There's some good suggestions and guidance on it that's come out as kids have been in childcare and trying to figure out what's appropriate. Kind of good ways to talk about it and to make it seem less punitive, right? And I would certainly suggest, that you could encourage them to make their own masks, and then it's a very personal thing. And some programs are even like having kids participate in the like sewing construction of the masks. So there's some creative ways people are trying to make it less punitive, but there's not really a great answer.
Yeah. So childcares they are having kids wear masks when they're doing childcare right now?
Some of them, and that's kind of a program to program and dependent at this point.
So that would be a place to sort of reach out, like say, how have you handled this and made it an okay or fun or at least not onerous thing?
And I think we've found a couple of articles and resources, so I'll make sure that we share that out to you.
I think that would be good, because I think it's going to be a question for a lot of people. Just like, camp is supposed to be fun, and it's already hard enough to get kids put their socks on sometimes, or put on their hat when it's, they need to be protected from the sun. And putting on a mask, I just can't. Oh, it's hard to imagine.
It's a different world.
It is a different world. It's a different world. Well, thank you.
Yes. I hope this has been beneficial. Make sure there's any last questions, or if you don't know if I have your email, feel free to put it in the chat box so you can get any updates and the recording. And hi, Julia Betts. I see your name there. I'm gonna go ahead and close this down if there's no other questions. Thanks everyone for joining in.
Thank you.